Hello, I'm Alex Shirazi-Raffel, and I'm a second-year fellow at City of Hope Comprehensive Cancer Center. Today, I will be presenting our abstract entitled Distinct Cytokines Predict Response to Immunotherapy and Targeted Therapy in Metastatic Renal Cell Carcinoma. Here are our disclosures. The landscape of systemic therapy for metastatic renal cell carcinoma has undergone considerable change in recent years. At present, immune checkpoint inhibitors, or ICIs, vascular endothelial growth factor tyrosine kinase inhibitors, or VEGF TKIs, and combination therapy with both an ICI and a VEGF TKI are approved by the FDA. With numerous treatment options and no firm consensus regarding their optimal sequence, biomarkers to select patients who will benefit from systemic therapies are urgently needed. Several groups have explored cytokine concentrations as potential biomarkers for RCC patients on VEGF TKIs. Biolin and colleagues identified a panel of 7 cytokines that were negatively associated with clinical benefit from first-line sunitinib, including IL-8, IL-9, and TNF-alpha. Tran and colleagues retrospectively noted negative associations between overall survival from frontline pazopanib and pretreatment IL-6, IL-8, VEGF, osteopontin, HGF, TIMP1, and E-selectin. Zazari and colleagues demonstrated that interferon gamma, soluble PDL1, and soluble CTLA4 were inversely correlated with clinical benefit from sunitinib or pazopanib. Within our own institution, we prospectively replicated negative associations between clinical benefit from pazopanib and levels of HGF, VEGF, IL-6, IL-8, and soluble IL-2 receptor. Similarly, investigators have examined outcomes using cytokines as biomarkers for RCC patients on ICIs. Transcriptional analysis established that nivolumab induces elevated peripheral levels of interferon gamma, CXCL9, and CXCL10. Additionally, Schalper and colleagues showed that baseline IL-10 may be a negative prognosticator for ICI's effectiveness across several tumor types, including RCC. More recently, Wang and colleagues used machine learning techniques to identify an 8-cytokine composite immune signature that was prognostic for overall survival for RCC patients on nivolumab. To further evaluate the efficacy of cytokines as biomarkers in metastatic RCC, we conducted a prospective trial to determine if various pretreatment and on-treatment cytokine levels in peripheral blood predict clinical outcomes for patients with metastatic RCC receiving either ICI or VEGF TKI therapies. All participants were planned for treatment with either a commercially available ICI or VEGF TKI therapy approved for metastatic RCC by the US FDA. Enrollment was open to patients across all RCC histologic subtypes, IMDC risk stratification, and lines of therapy. Peripheral blood samples were obtained from each patient prior to the initiation of systemic therapy with either VEGF TKI or ICI at 1 month subsequent to therapy initiation. A panel of 30 plasma cytokines was quantified for each plasma sample using the human cytokine and Vitrogen 30-plex protein assay on the Luminex FlexMap 3D system. Patients were treated with either VEGF TKI or ICI until disease progression or discontinuation due to adverse events, death, or subject or investigator decision. Clinical benefit was classified as a complete response, partial response, or stable disease in excess of 6 months per clinician's evaluation. Individuals experiencing primary progressive disease on therapy or who achieved stable disease of less than 6 months were classified as experiencing no clinical benefit, or NCB. We analyzed 56 patients who were treated at City of Hope Comprehensive Cancer Center between 2016 and 2019. Of these, 40 patients were male and 16 were female, with a median age of 67. Median lines of therapy received was 2. The most common ICI rendered was nivolumab monotherapy, and the most common VEGF-TKI was cabozantinib. 7 patients achieved partial response, and 25 patients achieved stable disease as a best response. 17 patients experienced progressive disease, and 7 discontinued treatment due to toxicity. Clinical benefit was similar in patients receiving VEGF-TKI and ICIs, 65% versus 54% respectively. Treatment-related toxicities were reported in 36 patients. The most common toxicities were fatigue in ICIs and hand-foot syndrome with VEGF-TKIs. Patients with clinical benefit from VEGF-TKIs had lower pretreatment median levels of IL-6 with a p-value of 0.02, IL-1 receptor antagonists with a p-value of 0.03, and G-CSF with a p-value of 0.02, compared to patients with no clinical benefit. No significant pretreatment cytokine differences were seen amongst clinical benefit and no clinical benefit patients on ICIs. Additionally, we assessed cytokine concentration change from baseline to 1 month on therapy. To normalize values, we then converted these relative changes into ratio form. Patients who derived clinical benefit from ICIs had higher relative values of interferon gamma, IL-12. For patients on VEGF-TKIs, those with clinical benefit had lower relative values of IL-13 and GM-CSF, as well as higher relative values of VEGF as compared to those without clinical benefit. Additionally, we assessed progression-free survival for all cytokines. However, although all cytokines demonstrated signals of PFS benefit, the only cytokine with significant PFS benefit was on treatment VEGF with a p-value of 0.03. There are several limitations to the present study. We included a small number of patients and did not include a healthy control arm. Subjects included in the study were sourced from a single hospital and may not be representative of the general population. Lifestyle-related variables, which may affect the levels of cytokines, were not accounted for in the present study. In addition, the heterogeneity of therapy line and thus previous exposure to VEGF-TKI and/or ICI therapy posed an additional limitation that was not controlled for within the study. In conclusion, we detected a significant association between peripheral cytokine concentrations and response to systemic therapy in metastatic RCC patients. Pre-treatment IL-6, IL-1 receptor antagonists, and G-CSF, as well as on-treatment IL-12, IL-13, interferon gamma, GM-CSF, and VEGF were significantly associated with clinical benefit from either a VEGF-TKI or ICI. This unique parallel analysis of VEGF-TKIs and ICI regimens supports the further in-depth study of plasma cytokines as biomarkers for immune phenotype stratification in order to provide more individualized treatment and improve patient prognosis for metastatic RCC. I would personally like to thank my mentor, Dr. Sumanta Paul, for his unending guidance throughout this project, our incredible biostatistician, Nora Ruel, for her tireless efforts, our chair of medical oncology, Dr. Ravi Selgia, for the opportunity to conduct this study, and the rest of our research team at City of Hope. Thank you.